Here are some skin and nail complications from frequent manicures. The most common complication is allergic contact dermatitis, which can cause a red, itchy, scaling rash on the fingers, the hands, and even other locations such as the eyelids or generally around the eyes. In some cases, it might only affect the eyelids, and so for patients who have recurrent itchy red rash around the eyes, I always ask about nail practices and evaluate the nails, as that might be the culprit. The most common offending agent is 2-hydroxyethyl methacrylate, which is present in 60% of nail cosmetics. There's so many other allergens, including dyes, formaldehyde, acrylic polymers, and monomers that are present in acrylic nails. This is onycholysis, when the nail starts to separate from the nail bed and starts to lift, and that's from repeated trauma, so repeated filing, chemical exposures, and even the removal of artificial nails. This is called pseudoleukonychia, which is when the keratin of the nail starts to break down from repeated exposure to nail polish. Ooh, this is green nail syndrome, otherwise known as pseudomonal nail, and this is caused by a bacteria known as Pseudomonas aeruginosa. Now, this is caused by the bacteria being trapped underneath the nail, so like an artificial nail, and so it breeds an environment where it can grow. This is our classic onychomycosis, which is a fungal infection of the nail, and this results in thickness, discoloration, and crumbling of the nail. This most commonly is caused by, again, moisture trapping underneath artificial nails or the use of non-sterilized instruments. And then we have acute or chronic paronychias, which involve inflammation of the lateral or proximal nail folds, and these are very red, swollen, painful, and these are most commonly due to infections either from trauma or repeated chemical exposures or irritant exposures. Here's a good old wart. These are caused by kissing frogs. Just kidding, they're caused by the human papillomavirus, which can be spread through direct contact with other infected skin or with the use of non-sterilized instruments, again, that are contaminated with the virus. Watch my latest in-depth YouTube video on all of these skin and nail complications from manicures, and I also offer some tips on how to prevent these complications.